Welcome to the Breaking Burnout for Nurses podcast. I'm Bonnie Kitahata, your host, and I'm so happy to have Melanie Wolf back with us again. I think this is our maybe third time together. So she's been a nurse since about 2005, right, Melanie? And
That's right.
She's in her 50s. She's 50 something, and she's done a lot of different kinds of nursing. So today, she's going to tell us all about nursing case management. All we want to know about nursing case management. So welcome, Melanie. And
Thank you.
I know you spend a lot of time in case management. So share with us everything you have about it.
Well, I think one of the biggest things I hear, I have a lot of direct patient care nurses or bedside nurses ask me, how do you get into being a utilization review nurse, or how do you get to work from home? Or that's the number one question. And I think so many bedside care nurses, it's such a different skill set when you switch over into the world of case management. And it's anyone can really do it that works as a nurse. But looking at the specific skill set that you need for case management. So I was a direct patient care nurse and I applied for case management in a acute care hospital in California.
Mhm.
And because I did have a business degree, I had a few other degrees. And so I was a biology educator as well before nursing. And so they liked, they saw my skill set. They saw that I could probably handle case management, even though I was coming directly off the floor. They took me and accepted me and gave me the position as a RN case manager. So it shouldn't be intimidating for floor nurses that are direct patient care nurses. You could certainly do the job, and I can kind of tell you specifically what it entails. And like, does that sound like something I would even want to do? Because there's a fair amount of stress involved with being a nurse case manager. And most of the time, the direct patient care nurses I do know are like, no way, I don't want that job at all. I see what they have to deal with. And so, but just so you understand what it is all about, what is the world? Now, I really enjoyed the job because I am good under pressure. And it definitely has a fair amount of that involved as far as the stress level can go up quite high. So basically, what is a RN case manager? Are you a manager? Like, what are you doing? Really, what you're doing is coordination of care. That's what you're doing. So let's say, God forbid, Bonnie here is admitted to the hospital. She breaks her hip. She has to go to a rehabilitative center post-acute stay, right? She's been at the hospital. She needs to be discharged to a facility so she can get her post-operative care. Well, someone like me, who is a nurse case manager, is going to handle that transfer to the facility. So what does that mean? That means I am a discharge planner. I'm going to be the one who is coordinating the care. So I'm going to make sure that doctor in the hospital talks to the doctor at the facility if that's necessary. I'm going to coordinate the ambulance ride if she needs that. If she needs oxygen, whatever she needs to get her safely from point A to point B, I am going to be coordinating the care. I'm going to be talking to the family members. I'm going to be talking to the doctor. I'm going to be talking to the ambulance driver. I'm going to be talking to the admission coordinator over at that facility to make sure they have a bed available. There is a lot of coordination going on. And so people who are extremely organized, who really love to organize and cross the T's and dot the I's, you're going to be really good in case management because there's a lot of details that go along with that. So that's such a big part of it. And the other piece to it, so your discharge planning, and then the other piece is utilization review, which we've talked about in a previous episode.
Yes.
So you are nursing. That just means when Bonnie gets admitted, I'm using Sweet Bonnie here as an example, but she's admitted, I have to go through criteria to make sure she really needed to be admitted to the hospital in the first place. So I'm going to use this criteria called InterQual or Milliman Care Guidelines, and I'm going to justify her hospital stay by clicking some boxes. Yep, she's fractured her hip. That's what it looks like. Or she's fractured her femur. And yep, it looks like she's had surgery. The orthopedic guy has said, yep, she needed surgery. And yep, she's going to have to go to a rehabilitative facility post-acute stay. She can't go home. So you're looking at all of those. So you're going to be, doing the UR piece and then also the discharge planning piece. Those are two of the big things that you're doing as a nurse case manager. The other fun part of it that a lot of people don't always talk about, but you are kind of playing social worker a little bit. You're kind of wearing lots of different hats. So if the guy on the unit who's causing a lot of grief, you're going to have to go in and talk to him, possibly if the social worker is not available on the weekend. And let's just say you're the one on, and everybody's going to look for the nurse case manager because you're the one that's going to be dealing with that. And the difficult parts of the job are, we've got Joe here who's been in the hospital for 90 days and we can't seem to discharge him because maybe he's an IV drug user. We can't send him out to the street with a PICC line. It's a liability for the facility. So there's all these what we call complex case management, which I've done that as well. And so those are your cases where you just can't get them discharged. No other facility will receive this patient. Maybe they have, unfortunately, a history of being combative or aggressive with staff, and they're just a patient that unfortunately, for whatever reason, maybe they've got a mental dual diagnoses with drug addiction and mental illness. We just can't get them discharged. We can't get a receiving facility to accept them. So that is a big part of the complex case management where you have just really tough cases. I mean, I remember having a case in Santa Cruz County years ago. I worked for Managed Medicaid for the state of California. I was a UR nurse, but we did a lot of case management. So I had a gentleman who was about 400 pounds, really very sad case. He had congestive heart failure with an ejection fraction of about 10%. He needed a CPAP machine. He's homeless and he's a meth user. So we couldn't send him to the street. We had to send him to a hotel so he could get that CPAP plugged in and be able to use it, or he wasn't going to survive. And we had to have a home health nurse go in. So there were all kinds of arrangements you make with really tough cases like that. So that is a big part of your job if you're a case manager in most acute hospital facilities. Now, you could be a case manager in a surgical center, and that's a little bit easier. You're dealing with a standard, we've got the ortho patient, bunch of hips, bunch of knees, just so the surgical patients, post-operative patients you're dealing with. So it depends on what arena you're working in. But if you're working in tertiary, if you're working at Stanford or you're working at UCLA or you're working at a little tiny acute hospital on the coast of California, or if you're working in a rural hospital, you're going to be the go-to person for everything because there's no specialty, right? It's just kind of like if you're an ED nurse in a rural hospital, you're going to be handling every case under the sun. So you're going to be more of a generalist, right? And that's kind of how you are as a case manager in a small hospital, which is what I was. So you kind of handle every single case. You're working a lot with the nursing supervisor. So the RN supervisor that is handling all those hospital transfers. Oh, we got another admission. You're going to be the one working with that nursing sup to ensure that the transfer goes well. They're going to be working directly with you, communicating, a whole lot of communication in these nurse case management jobs. You've got to be an effective at some level communicator because time is of the essence. If you have an emergent transfer, you got to get them out of the ICU and get them into the next place. And of course that can, fight for life. You can have all kinds of other entities involved in the transfer. You've got to make sure the physicians are talking to each other. There's just a lot of pieces to the puzzle. And I always would say, I want someone to be discharged with a nice bow tied, with a nice wrapped up like a gift. Like, yep, everything has been handled. All the boxes have been checked. They've got their oxygen. They've got the receiving end when they get to their home. They have someone to land and help them with whatever medical equipment or whatever they needed to make sure it is a safe transfer, whether they're going home or to a facility. So that's kind of the nutshell of it's a lot. There's a lot to case management. And
it sounds like a lot of phone calls and then probably waiting for them to call back. And you want them to hurry up and call back so that you can make the proper next phone call. And so I was going to ask if you deal with talking with the insurance companies as far as the coverage of whatever their care is going to be or needs to be. Are you part of that conversation too?
Yeah, you're doing all kinds of communication with the insurance companies. You're dealing with, so yeah, the pressure comes in when you've got a patient, let's say they've had a heart attack and they need this certain medication. Before we can discharge them, we have to make sure that medication is available for them and their insurance won't cover that medication. Maybe it's a new heart medication. And so you kind of fight with them. And then also the physicians, depending on the physicians, some are a little easier to flow with than others, as we know. And of course, we appreciate all of our clinicians and providers, but sometimes it can be tough if you have, say, a cardiothoracic surgeon or an intensivist, and they're putting the pressure on you. Why is it this patient discharge? What's going on? And you have to be, hey, we don't have a bed at the receiving facility. We're waiting for a bed, or we can't get the ambulance over here. They can't get over here until this time. Or there could be a million reasons going on. There may be an issue with the family member. I mean, who knows? There could be lots of things going on in these scenarios, right? So, but yeah, you are dealing with insurance all the time, and is one of kind of your thorn in your side when you're dealing. And I've worked on the insurance side, so I know what they're dealing with on their side, and then I know what we're dealing with on the other end of it. So, yeah, I think it's just with insurance, you really do have to have approvals for lots of things. Like if you have a Medicare Prime, which just means it's Medicare, you just hand them a walker and out the building they go. Unfortunately, if it's like, I don't know, whatever carrier, I'm not going to throw names out there, but any of the big guys, right? Blue Cross, United Health Group, Cigna, any of them, Humana, they're going to say, hey, wait a minute, is this medically necessary? Do they really need that walker? And you're going to have to go through kind of a series of process, sometimes submitting paperwork to get this particular equipment approved. And of course, to where we can get them out of the building, right? To get them discharged in a timely fashion. But yeah, all those things are pieces of the puzzle for anyone discharging. And it can be quite frustrating on your end as a case manager, especially the hardest part of the job truly is playing social worker, having to go into that room with that very difficult patient. And the nurses are all like, Melanie,
or family member.
Or family member, it sounds like you're frustrated right now. What's going on in here? You got to really have that tact and professionalism, as we all do really in the nursing field, to not take things personally, right? When they're using not choice words with you and
or very choice words.
Yeah, we have to really, realize that they really are suffering and hurting and in pain or whatever is going on. They're helpless and they're in a situation where they really are relying on us for good care. And so, but yeah, it was always a challenge when you have those types of patients and family members you certainly are dealing with consistently as a case manager, because when you're discharging Joe, whose wife Judy, they've been married 50 years. She's concerned about him going to the facility. You've got to put her mind at ease. You've got to put Joe's mind at ease. I can't tell you how many seniors I've talked into going to a facility because they think, oh my God, you're going to send me over there and I'm going to die. That's how they see a facility. And all we're really doing is sending them over there for a post-operative care. And they just have this idea in their mind. So it just depends on the situation. But every situation is really different, but you really have to use a lot of tact and choose your words wisely when you're dealing with patients. And also the other flip side is when I was an ICU case manager, you also, and I know Bonnie has you have a background in intensive care. Sometimes you have to have those difficult conversations with family members. You're the person that, the 20-year-old kid who goes down on a bike and is in cardiac arrest for a long time, and he may have a noxic brain injury. You're the one who has got to go talk to family member and really discuss maybe the options for this patient. And so you have a lot of those kind of conversations that can be very challenging, especially if someone is kind of a catastrophic injury or something has happened. You're the case manager. You're the one who has to kind of play social worker a little bit, especially if your LCSW, your licensed clinical social worker, is not on the unit and not available. You have to kind of jump in, and you're kind of part of that team. You're part of the LCSW. You work very closely with them in the field in all kinds of cases, because you are the discharge planner. You've got to get, unfortunately, a lot of drug addiction, as we know, working in the medical field is very common. Many of our patients. And so we have to work with a social worker to get this person discharged, have a safe plan, hopefully good follow-up where we can prevent another hospital admission. And so all those things come into play. They obviously don't want people being readmitted. And so it's very important to have your discharge plans really dialed in as much as you can with good follow-up. Making sure if they have heart failure, they're plugged into the CHF coordinator, whatever they're dealing with, to make sure you have follow-up so that disease process can be followed and closely monitored, so we can prevent another readmission. So that's a big one for case managers, and kind of the expectation of you when you discharge.
Now, Melanie, if somebody is listening to this podcast and thinks, okay, that is my dream job, I want to be a case manager, a nurse case manager, what steps do they take in order to move toward that case management job?
I would just say
inspiring them.
Or maybe frightening them. I'm not sure which one it is. But I would say just apply for whatever case management position that's available. Just keep applying, because even if you're a case manager in a facility, if you're a case manager in a rehab facility, if you can't quite get into an acute position, acute level of care position, or tertiary, if your dream job is to be a case manager at Stanford, which they have an excellent team there, I've worked with many of them. So if you want to be at that higher level, just start wherever you can get a position. And I would just say keep applying and learn as much as you can about what is a case manager. Learn about discharge planning. Even talk to a case manager on your unit. If you're on a med-surg unit or cardiac unit, tele, or whatever unit you're working on, there is somebody there who's discharging patients. And I would really talk with them about it and say, hey, I'm really interested in doing this. Can you tell me about your job? Because if you do get an interview, it can really put in, hey, I know what interqual is. I know what minimum care guidelines. Those are some, they want to know that you have some idea of, and they can always train you, and then just kind of work on learning what it is, and maybe, shadowing a case manager on a busy hospital unit, and see like what they do and what they're dealing with, and just kind of get some advice from them as well, like, and how they got hired in that position, because it can be a little bit more competitive, but it just depends on the hospital. If you're in a small rural hospital, and they see that you're competent on the unit, and you're a good nurse, they're going to look at your skill set. And so, yeah, I would just apply and really beef up as much as you can on your on my application process. I always take a lot of time when I apply. I always encourage people, really talk a lot about who you are, why you want the job. Don't just do a paragraph, because you're getting a lot of submissions. Really set yourself apart from everyone else. Like, I know I can do this job. Really put your skills and attributes that you feel would be helpful. I'm a great communicator. I'm really good in those really sticky situations with family members. And I work well with physicians. I work well with, because you're dealing with like how many different entities. So you are working with lots of different humans, and you've got to be able to flow and work well with a lot of different people. So just, looking at all those things, and then applying as if, hey, I'm the one, you need to choose me, and just really putting yourself out there. And that's what I would do.
And do you think, would there be a specific training for case management, or on the job training type thing? Would you go through a case management course, or would you be trained by the offgoing case manager? What would you say?
There's a certification you can get specifically for case management. There's different
Oh, okay.
types of case management you can get a certification for. If
Mhm.
someone really wanted to get into case management, they could just go ahead and you can actually look online. You can just get a certification for case management. And boy, if you have that on there, a
Mhm.
CCM, it's also helpful. Great question, Bonnie. Yeah, I mean, if you wanted to do something like that, just to set yourself apart, like, hey, I really want to be a case manager, and I've already gotten my certification to say case management. See, I've already like put the work in and done my homework on this. And so that's definitely something you could do. As far as the training, they're definitely going to train you as soon as you hit the floor. You're going to get, they're going to train you in interqual. You'll have to do all the training for interqual certification. You actually
Mhm.
can't even work and use interqual until you pass the test. There's actually a test you have to pass, an exam, and also for Milliman Care Guidelines, you have to pass those exams to make sure you're
Mhm.
proficient enough. You don't have to be
Mhm.
crazy proficient, but you got to be at least the basic proficiency to be able to check the boxes and make those, because you're doing a lot of justification of hospital stays, and that
Mhm.
takes some critical thinking and analyzing, and they just want to make sure you kind of
Mhm.
know what you're doing at some level. But yeah, you'll
And
get all the training.
how long is that training for the interqual, you said?
Interqual. So these are the guideline criteria. These are basically when we check the boxes, like poor Bonnie here was admitted with her hip fracture. We literally, there is a box that says femur fracture, hip fracture, per x-ray, per radiology, and you
Mhm.
literally check a box. And
Mhm.
so, but yeah, it's the criteria that we use to justify hospital stays. That's what
Mhm.
interqual is. And the other one that's kind of another gold standard is called Milliman Care Guidelines. And different hospitals use different ones, just depends on the hospital system, but interqual and
Mhm.
Milliman Care Guidelines. And it takes, you just have to study a little bit to take the exam. It's just it's like, I forget how many questions. You just answer the questions, and that's it. You just take the exam.
I mean,
And
would that take months to learn or to go through that, or
mm-mm.
just
No,
like
it's
a CE class or something like that?
kind of like a CE class. Yeah,
Oh,
it's kind
okay.
of like that. I mean,
Mhm.
they throw you on the unit. At least was my training. They threw me directly on the unit and shadowing another case manager. And like, I was watching what she did as far as you start to learn, right? The slam
Mhm.
dunk cases, MI, femur fracture. Some of the ones are just like slam dunk, meaning, yeah, they meet. There's no question.
Mhm.
But if
Mhm.
somebody gets admitted and they have a very complex diagnosis, that's when it gets hard and challenging to make the correct, like, should I put them under heart failure? Should I put them under diabetes? Like, they've got like 5 different things going on. What are we doing here? And so those are the more challenging cases when you're using interqual and MCG. But yeah, you'll totally get the training, and nothing to be afraid of. And of course, this is something you use every single day of your life in case management. Every day you walk in the door, you're opening up the interqual. Here we go. We're going to check some boxes today. So you're using it every single day, even before you take the test. So you're going to know, you really start to know it really
Mhm.
well, because you have to know it to do your job. It's just one piece of the puzzle. It's the discharge planning piece, and the UR piece is you have to know the stuff to do the job effectively.
All right, so I hear the pros for you seem to be you love a challenge, you love interacting with people over the phone and in person, and very almost regimented by going along with these the qualifications to qualify for um, transferring somewhere, or not qualifications, but yeah. And so, what would be some of the cons that you would warn some nurses about? What would be some of the cons that you would say?
Yeah, I would say, well, the pros are certainly analytical. If you like to analyze
Yes.
cases and problem solve,
Mm-hmm.
boy, and you're a good communicator, and you enjoy hospital transfers, and you like helping people that are dealing with difficult situations with family members, and you're really good with empathy and helping them and serving that way, boy, you're going to nail it with case management. The cons are going to be the stress.
Mm-hmm.
You've got the landline. I used to have, well, remember the landline phones we used to have? I had a landline here,
Yeah.
a cell phone here. I'm talking to the doctor. I've got a
Yeah.
family member over there I've got to talk to. You got
Yeah.
like, you're
That's pretty
juggling.
cool though, right? You could do
Yeah,
10 things at once.
that's exactly what you're doing, is crazy multitasking. And it's also just the time constraints. You've got to get people out by 2 p.m., right?
Mhm.
So you got to get 10 people out by 2 p.m. So there's a lot of push and a lot of drive. We got to get these people discharged. We've got to have that bed available, right? We got incoming patients. So it's the stress level. And I always tell people, the slower I go, the faster I'll be, so really slowing the
Yeah.
pace, not running down the hallway to check out
Yeah.
your patient that's discharging. Walk slowly, stay in the prefrontal cortex up here, the thinking part of your brain, instead of spinning out, which I have done before, because you just have so much pressure on you from the physicians, and you're the go-to person. You're the discharge planner. That go talk to the case manager. She's the one handling this case. Go talk to her. She's the one talking to the nursing supervisor on these admissions that are coming in. So, and every admission that comes in, you've got to handle all the admissions as far as making sure they need to be there with all the medical criteria. And so you're doing all the admissions as well. So it's just the pressure of the job, the stress of the job, and those really difficult situations where you're like, oh man, I don't know if I want to go in and talk to the problem child on the unit. And but though that's your job, you got to go in. But sometimes if you learn like de-escalation techniques with patients and ways to kind of get them. I mean, I had a patient cry on me one time because I was actually listening to him, and he didn't think anybody cared. And so empathy is huge in your job as a case manager. Like it's not about you anymore. It's totally about the patient. And if you can come at it with that perspective, it makes life a lot easier for everybody. And so yeah, it's just, I would say in a nutshell, the biggest con is like, and I'll throw this out there. I did work with a case manager at French Hospital down in San Luis Obispo, California. And her name, I won't say her name, but she was incredibly calm at all times. I just admired her because she never got stressed. And, the rest of us are running around like little chicken with our heads cut off, like you do in nursing. And she was just like calm and cool and collective at every situation that could possibly be happening. She would just be walking slowly down, not slow, but slowly, like taking her time to get to the patient's room. And she just didn't raise her voice. She was just very like even keel. And that is really a great attribute to have as a case manager. And I learned from her to like, nobody's dying right now unless they are dying, right? But at this point in time, there's no reason, there's no emergency. Why are we acting like there's an emergency here? There's not. The ambulance will get here and we're doing our best, right? And so, but she taught me a lot about just staying calm. That's if you're kind of a calm nurse and in the midst of craziness, you can really keep your head and wits about you. You'll do well in case management, because that's a really good, because you've got 10 people discharging at one time, and here comes the ambulance for this guy, and you got this other lady's going, and it can be a little busy and crazy sometimes. So, but if you really can keep your head about you and your wits about you, you'll do really well in that.
Yes, Melanie. It sounds like a case manager really is kind of like the hub, because you are in contact with the nurses. I mean, the patient, of course, but the nurses, the supervisors, the doctors, the agencies, the insurance company. I mean, you have your fingers everywhere, contacting everywhere. And so it sounds like you're like the hub of the wheel there. So a lot of responsibility. So yeah. Well, thank you. Any other words of wisdom?
Yeah, I would just say go for it. If you don't want to do bedside care, I always say in nursing, there's always something else to do. If you're tired of what you're doing, don't stay in it because it doesn't serve you or the people you're serving. So just go do something you want to do. For me, I was kind of tired of direct patient care, working night shift. And I was like, I want to do something different. I'm going to apply for this case management job. And I got it. And so no one could believe I was off night shift and I was in this case management role. And so all the responsibility, boom, but I was handling it really well. But again, go for it. Try it out if it's something you really want to, or at least scope it out and talk to the case management
Mhm.
team at your hospital or wherever you're working, and just give it a go. What do you have to lose? You might as well try something different if you feel like, hey, and it may not be for you, but you could give it a go and
Mhm.
see.
Melanie Wolf, thank you very much for being on the show. So let's
Mhm.
see, if somebody wants to follow you on social media, where do they go?
Yeah, so I'm Melanie Wolf. I'm definitely on I also have, I wanted to mention, I have a program called Rooted and Regulated. It's certainly for dysregulated nurses, which, my goodness, we all are, right? But
Yes.
it's called Rooted and Regulated. You can find me at regulatewithmelanie.com.
Okay,
And
that's
so
your
that's my
website.
website. And
Great.
then, and I'm certainly on all TikTok, Facebook. I never thought I would join TikTok, but honestly, the algorithms work better in my favor. And then Facebook, Instagram, Melanie Wolf. I also have, if you look on Facebook, there is the Rooted and Regulated Facebook group that I have to help people who are struggling with just kind of burnout, dysregulation. And so I definitely serve colleagues as well, nurses that really just need kind of a nervous system reset, and they're feeling on that verge of burnout, which obviously is what we're addressing here too, is the breaking burnout piece. So definitely check it out if it's something you might be interested in.
Well, thank you, Melanie. And we're going to have you back again to talk about your vagabond nurse life in your new Sprinter van. What's the Sprinter van's name?
It's Rosie. It's
Rosie. All
Rosie.
right. So we're going to have you back to tell us about your vagabond nurse life. And
Okay.
everybody out there, come back next Monday at 10 a.m. Pacific. And we are breaking burnout here.
Okay, great. Thanks, Bonnie.